I'm Dr. Donna Gourlay, and this presentation will cover the 10 essential services for public health. These slides were originally made for the CDC in 2014, and I've modified them for you. First, a little history. The core public health functions were outlined in the 1988 Institute of Medicine report, The Future of Public Health. The IOM report stated that the three core functions of public health are assessment, policy development, and assurance. This is a good start to describing public health, but in 1994, when the country was exploring issues related to healthcare reform, the public health sector felt that a better definition and description of public health was needed. A core functions of Public Health Steering Committee was convened and involved representatives from public health service agencies, CDC, HRSA, Office of Disease Prevention and Health Promotion, and key national public health organizations. The committee produced a statement called Public Health in America. Public Health in America, Vision and Mission. The Public Health in America statement provides a vision and mission for public health, as well as the context of what public health should be prepared to do and how public health service is delivered. The vision for public health is broad: healthy people in healthy communities. The mission identified is to promote physical and mental health, and I would add spiritual health, and prevent disease, injury, and disability. These 10 essential services provide a framework for defining health activities, describing public health at all levels, defining national performance standards, and providing accreditation structure for health departments. Now I'm going to briefly go over the 10 essential public health services individually and summarize what they are intended to meet. The first one, ES1, I'm calling them Essential Service or ES1. ES1 answers these questions. What's going on in our state or community? Do we know how healthy we are? These include accurate periodic assessment of the community's health status and includes identification of health risks, determinants of health, and determination of health service needs, the vital statistics and health status indicators of groups that are at a higher risk than the total population, and identification of community assets that support local public health systems, or LPHS, in promoting health and improving quality of life. Also, appropriate methods and technologies, such as Geographic Information Systems, or GIS, are often used to interpret and communicate data to diverse audiences. Collaboration among local public health service department components include private providers and health benefit plans to establish and use population health registries, such as disease or immunization registries. Essential Service 2, ES2, answers these questions. Are we ready to respond to health problems or threats? How quickly do we find out about problems? And how effective is our response? The service includes epidemiologic investigations of disease outbreaks, patterns of infections, chronic diseases, injuries, environmental hazards, and other public health threats and emergencies. Active infectious disease epidemiology and programs, and access to public health laboratory capable of conducting rapid screening and high-volume testing. ES3 answers this question. How well do we keep all segments of our state or community informed about health issues? This addresses health information, health education, and health promotion activities designed to reduce health risk and promote improved health. Health communication plans and activities such as media advocacy and social marketing. Accessible health information and education resources. Promoting partnerships with schools, faith-based communities, work sites, personal care providers, and others to implement health promotion programs and messages. ES4 answers this question. How well do we truly engage people in state or health community issues? These include identify potential stakeholders and increase their awareness of the value of public health, build coalitions, partnerships, and strategic alliances to draw upon the full range of human potential and material resources to improve community health, convene and facilitate partnerships and strategic alliances among groups and associations in undertaking preventive screening, rehabilitation, and support of public health projects. ES5 answers these questions. What policies in both the government and private sector promote health in our state or community? And how well are we setting health policies? These include effective local public health governance, development of policies, codes, regulations, and legislation to protect the health of the public and to guide the practice of public health, systematic local public health services and state-level planning for health improvement in all jurisdictions, alignment of local public health service resources and strategies with community health improvement plans. ES6 answers this question. When we enforce health regulations, are we technically competent, fair, and effective? In other words, are we assuring due process and recognition of individual civil rights in enforcement of laws and regulations and public health emergency actions taken under the governing body's authority? Do we review, evaluate, and revise laws and regulations designed to protect health and safety, reflect current scientific knowledge, and utilize best practice for achieving compliance? Do we educate people and entities obligated to comply and agencies obligated to enforce laws and regulations? Do we perform enforcement activities, which oftentimes are environmental in nature, in a wide variety of areas under authority granted by a local, state, and federal rule or law? Some examples include, and this is where the environment comes in, abatement of nuisances, animal control, childhood immunizations and other vaccinations, food safety, housing code, local sanitary code, on-site wastewater disposal such as septic systems, protection of drinking water, school environment, solid waste disposal, swimming pool and bathing area safety and water quality, tobacco control, enforcement activities during emergency situations, and vector control. As you can see, most of these that I've just listed define environmental health. ES7 answers this question. Are people in my state or community receiving the health services they need? These include identifying populations with barriers to personal health services, identifying personal health service needs of populations with limited access to a coordinated system of clinical care, linking people to appropriate personal health services through coordination of provider services and development of interventions that address barriers to care. Essential Service 8 answers these two questions. Do we have a competent public health staff? And how can we be sure that our staff stays current? This includes education, training, and assessment of personnel, including volunteers and other lay community health workers, to meet community needs for public and personal health services, efficient processes for licensure of professionals, adoption of continuous quality improvement and lifelong learning programs that include determinants of health, active partnerships and strategic alliances with professional training programs to assure community-relevant learning experiences for all students, continuing education in management and leadership development programs for those charged with administrative or executive roles. Essential Service 9 answers these three questions. Are we meeting the needs of the population we serve? Are we doing things right? And are we doing the right things? This essential service includes the assurance of ongoing evaluation and critical review of health program effectiveness based on analysis of health status and service utilization data, and the provision of information necessary for allocating resources and reshaping programs. The last one, Essential Service 10, answers this question: are we discovering and using new ways to get the job done? Public health research activities include initiating research, participating in research by others, reporting results, and implementing policy based on these results. Now, the public health wheel illustrates the three core functions of assessment, policy development, and assurance in black around the wheel of essential services. In principle, the 10 essential services can be grouped under the three core functions. Starting at the top of the wheel, essential services 1 and 2 fit under the core function of assessment. Essential services 3, 4, and 5 fall within policy development, while essential services 6, 7, 8, and 9 fit under assurance. Research, essential service number 10, and system management form the center of the wheel, since these activities are included within all three core functions. This has been a review of the core functions and essential services for U.S. public health. I'm Dr. Gourlay. Thanks for watching.